Hello, all. This is Dr. Zarina, Dr. Z. Most of you do know me as Dr. Z. Some of you still call me Dr. Hood, which is completely fine. That is my name. I wanted to come on here and kind of reintroduce myself. Um, and actually, I'm wanting to begin to share with you all in a more personalized way when I'm coming to you to give you a couple tips and strategies in real time. And hopefully, you'll be able to engage with me in real time so that we can actually all together obtain that pain freedom and rebound our lives and get back to a quality of life that we all want and that we all deserve. So, the couple of times you'll see me uh, more regularly with the attempt to again share with you some tips and strategies to help you obtain your pain freedom and help you obtain your best life and from a physical, mental, and a whole wellness perspective. So first of all, I wanted to let you know that I am a medical expert in sports medicine, integrative medicine. I've had extensive training and extensive experience in this field, as I did go to medical school, then further my education and training through accredited fellowship in sports medicine, integrative medicine, where I was able to attain extensive experience treating professional athletes, Olympians, as well as collegiate. So kind of across the whole gamut. And not just that, also the regular people who are out there, hardworking people, be they factory workers, or nurses, our school teachers, and oftentimes you don't have to necessarily go through some big major traumatic injury and then to have chronic pain or to have subacute pain or just these little nuance or just annoying issues that kind of linger and don't seem to go away. Even my stay-at-home moms doing a lot of lifting and a lot of repetitive type of um, functions in their daily lives that actually can result in some issues over time, and without appropriate workup and appropriate assessment to kind of evaluate what could be helpful to treat this, which typically comes down to lifestyle, quite frankly. Um, they can turn into chronic pain, and that's one of the things. One of my life goals is to try to prevent. I don't think anybody has to live with pain. Um, so I do believe in pain freedom. But pain freedom is not so much what you think it sounds like. Like zero pain, oh, sign me up. It's not so much about that as much it is about um, the quality of life. And pain freedom is also, quite a lot of times, is about the mindset that you are going to carry along with that. Typically, I will tell people who tend to have, who come to see me and say, Dr. Z, I really, really have a lot of pain. I've been to this doctor and that doctor, and no one seems to be able to identify their true pain source. Or they'll say, my MRI was negative, but I'm still in a lot of pain. Or I had the surgery and that was supposed to fix it, but I'm still in a lot of pain. And I often tell people that at the end of the day, pain is not one dimensional. Pain does start, or to say, oh, Dr. Z, they told me it's, they kind of just imply that it's in my head. And I actually tell them that's because it is. Actually, really is in your head. But that's more in a physiological way, not to be insulting or to be to belittle what they're feeling, but actually to give it, to validate it, to give it some um, real attention, because the pain center does start in the brain, and you can't even feel pain if your pain center is not intact. And it's actually also very, very closely connected or associated or in proximity to the emotional center, also, what we call the amygdala, which is the emotional center. So pain and emotion, they actually go hand in hand. And that's why pain and depression typically also go hand in hand, or pain and anxiety. So you often can't treat one without the other. And if you do, you typically will not be very successful. And that's part of one of the issues I think that is concerning, and that's more of the epidemic, if you want to say epidemic, of pain in America or in our country or around the world, quite frankly, has more to do with the um, in my opinion, has had more to do with the undertreated aspects of pain as a totality. And we're looking at one particular area more often than not. And trying to treat pain from a one-dimensional perspective, are going to typically have us fall into not being able to treat it very well. So a big part of my practice actually is related to multifaceted and treating you as a whole person in a wellness approach, if you will. So most of my patients, when you come in, they'll tell you, we're going to go over nutrition. We're going to go over what are your activity levels are. What is your support system? What does your daily life look like? What are your stressors? What makes you happy? What are your sensitivities? We go through all of those things because those things are part of who you are, or what is in your current state, at least in your current state of mind. And those things affect your pain. What is your sleep hygiene like? All of those things affect that. So we kind of have to, in our practice, I'm going to approach it from that perspective. I'm not just going to look at you came in and you said I had a rotator cuff issue, Dr. Z. Can you fix it? Yeah, we're going to fix it together. And one of my mottos is that you're the real MVP. It really is not me. You're coming to me, but I'm here to show you and to inspire you and to empower you, to let you know that you're really the MVP of this whole situation. And I'm no good or no better than what you allow me to be based on what you bring to the table. So I'm not for everybody, quite frankly. And people, I tell them that up front as well. I'm not for everybody. Because if you do come see me, I'm going to put you to work. Because I'm going to go to work. I'm going to go to work for you, and I'm not going to let up whatsoever. So part of that approach, again, like I said, is approaching it from multiple areas and multiple aspects. Not just that I have a shoulder pain. When you come to see me also, we're going to not just assess your shoulder. I'm going to assess your neck. I'm going to assess your elbow. I'm going to assess your wrist. I'm going to assess the way you walk, the way you sit. What is your employment or lack thereof? Are you sedentary? Are you not? Do you have repetitive activity in your daily life? Do you not? All of those things play a role into your pain. And that's something that I have to make sure that each every patient that comes to that door understands. But that's part of what brings me back to this video, why I'm actually doing this video, and I will try to continue to do more, is because even if you can't come into my office, you deserve this information. You deserve to have this information. You deserve to have an understanding. You deserve to have knowledge so that you can empower yourself and be free. That's why y'all my Be Free crew. So at the end of the day, that's what this goal is. I wanted to just kind of give everyone a shout out. I'm Dr. Z, like I said, and it was kind of a bit of a late night, hence I'm kind of getting home and getting out of the white coat very soon here. Try not to come in with it, but anyway, that's kind of what we'll be doing. Okay, so I'm glad you guys took a moment to listen to me. I'm not going to belabor the point, but I wanted to reintroduce myself, so to speak. You can follow me on Facebook, Twitter, Instagram, all the social media outlets at Dr. Zarinah, and that's DrZarinah. See you soon. We'll be talking soon. And you can also reach us at Rebound Integrative Medical Group. Our phone number, again, 678-902-4746 or 678-902-4RIM. Peace out. Be free crew. And I'll be talking to y'all soon. Thanks for tuning in.